Hey there, it's Dr. Karen. Thanks so much for taking the time to watch this special segment from the SLP Learning Academy. The SLP Learning Academy is a coaching program that helps pediatric SLPs through their trickiest case studies. So you're going to want to watch the following call if you've ever struggled to get a teacher to follow through with classroom accommodations, needed to convince a student to do home practice outside of therapy sessions, had students who didn't show up to speech on purpose because they didn't want to come, or if you've had parents who've questioned your therapy goals, or really any situation as an SLP where you struggled to get someone on board with something that you thought they should be doing in their best interest, then you're going to want to check this out. So I can't wait to share it with you. Let's go ahead and get started. So the case that I had shared before was the case of a student who had multiple diagnoses, and I wouldn't say multiple diagnoses, he'd been to a number of different specialists, and everybody was telling the parents something different. Some people were telling the parents that he had autism. Some people said he had ADHD. Some practitioners were saying that he had sensory processing disorder. So there were a whole bunch of different things going on there. So really the challenge became they weren't really sure who to listen to. They had some outside therapists, and as a result, they weren't really sure what to do for him. And there had been some disagreements in the past with how the teachers were handling the reading instruction. And so we had to be very careful with this particular parent, because they did not necessarily always, there wasn't the trust there. And so with this particular case, we had to be flexible. We had some administrators who really liked things to be very efficient and cut and dry with the meetings, and we really had to let go of that. And obviously keep it within reason. We couldn't let meetings go 3 hours long, but at the same time, we had to be a little bit flexible and sometimes just let the parents talk. So I wanted to talk through some information and a process that we used for this particular case, where the student was, where we were able to come to an agreement with the parents and really work through that working relationship. But I know I covered some of this on the last call, but we got cut off. So I wanted to just reiterate some of these things before I went through some of the steps that we took and the process and things that we always made sure that we did whenever we were with this particular parent, when we were trying to get them to buy in. And we didn't have to do this. Once we had established that relationship, the meetings went a lot quicker, but we had to really front load this because they just weren't really on board with a lot of the things that we were doing. So with this in mind, I wanted to share some of this research that I discussed last time. So a lot of our training focuses on therapy techniques. But when we actually look at the things that have an impact on treatment outcomes, there are a number of different factors. So one of those is extra therapeutic and client factors. So this could be things like their family situation, socioeconomic status, things like that. So things outside that are going on in their environment that are impacting their ability to function. So obviously someone who lives in a home with a single parent who's working all the time, it's going to be a lot different from someone who has two parents and has a parent that's going to sit there with them and do homework every day after school. So there are a lot of different factors that could fall into this category, but as you can see, those things can actually have an impact on the outcome. That's 40% of the impact that you see in treatment is from those factors there. And then another really big part is that therapeutic relationship. So how well, just really if there is a trust between you and the client, you and the caregivers. So, you know, obviously if you're working with kids, this would be the parents or guardians. Obviously, if you're working with adult clients, this could be the other family members who are taking care of that person, their spouse, things like that. And then obviously there's some motivation here, but then what's really interesting is that the actual technique that you're using in this particular study that I've got up on the screen, technique only accounted for 15% of the outcomes. Now, that being said, that doesn't mean that the technique is irrelevant, because obviously if this isn't here, then you're not going to see the outcomes that you want. You've got to be able to have the right technique so that when you build this relationship and when you leverage these things, that it's really just kind of multiplying. But with that being said, if you have a great technique, but you don't have that good relationship and you don't have buy-in, you're just really going to be swimming upstream. So with that being said, obviously you've got to have a number of people who are working with that particular client or student on the same page. So you've got to be thinking about all those different people who are working with this particular client. So this means that you might have conversations like this with not just the parents and not just with the student themselves, but maybe with some other colleagues that you're working with who weren't really quite sure of what you're doing in therapy. So this could mean that maybe you're having this conversation with a teacher who knows that they're struggling to get this particular student to do certain things in their classroom, but they haven't quite bought into some of the things that you're recommending. So you could use this process for that as well. This could be other therapists who you might be collaborating with, could be your supervisors. I would say that you probably are going to be doing this more so with these other people rather than your supervisors, but there are situations where you might have to sit down with your supervisor and really kind of talk through the things that you're doing. So with that being said, this is all about the readiness for therapy, because there are many situations when we're not going to get the results that we want if that person isn't ready for therapy. And you may or may not have a choice as to whether or not you can provide therapy. So for example, if you've got a student with severe autism or, you know, some other obvious disability, then obviously you can't just say, oh, we're not going to provide therapy because they're not ready for it, you know. So in certain situations like that, especially if you're a special education provider, you're an early intervention provider, obviously you still got to try in those cases. But then there might be other situations where there might be a little bit of gray area, and you can use motivation as a factor when it comes to recommending for therapy. Two examples that I can think of in particular, I had a student who was referred to me by the principal and by the classroom teacher, and it was for fluency. And then when I actually talked to the student and talked to the student's mother, who was going to be a big part of the intervention, they completely denied that there was an issue at all. The student was pretty, he was not bothered by the way that he talked. The teacher thought it was an issue because she said it's hard to understand him in class, but the student wasn't bothered by it, and his mother was very defensive when I brought it up. She actually was fixated on another issue. He was having seizures, and she said, oh yeah, he's having seizures all the time, but oh nope, he doesn't have any speech issues, nope. And she was very, so whenever I would try to dig in and figure out what symptoms there were and how fluency was affecting, she wouldn't give me anything. So there really wasn't any way that I could get her to see that this is something that he needs to work on now, because to her that wasn't something that she was really really willing to admit. And so they just weren't ready for me to do the therapy. And then also at the time I was in the schools, and since it wasn't really bothering the student, he was still participating, his grades were okay, I couldn't really justify the adverse effect. Now, if it was bothering him and he wasn't participating in school because of it, then I could have made that justification. There are a lot of cases with articulation where this is the case as well, where it's like, you know, if it's causing them to be unintelligible, if they are embarrassed about it, they're holding back, they're not participating in class, then yes, you can justify it. And if they're willing to work on it, but if they're not, then you can use it as a justification. So it's really important to have this conversation before, throughout the process, because the with getting buy-in, obviously, it's going to be really hard to get them to follow through with anything you say if they don't see why this is a problem right now. And if they don't understand why they're doing it, I know a lot of times we kind of come from a place of wanting to educate, but if we're just talking at them and just sharing this information, if they're not the ones that are making that connection themselves, then it's going to be really hard for them to form a habit and do all of those things. It's hard anyways. So for example, with me, my stepdaughter, I had to work on R with her, and I knew that if I didn't work on it with her, and if we didn't spend regular time every day addressing it, I knew what was going to happen. I mean, I knew that it would stay with her. I knew that she probably wouldn't just grow out of it like a lot of people say. I knew that if she continued to have that issue, that it would be hard to understand her. She wouldn't be as articulate, all of those things. I knew what was going on, but it was still hard for me to form those habits. So that's enough of a barrier there when you're asking parents, students to change their habits. So if they're not even motivated to do it, that makes it even worse. So, I mean, you've got to have that motivation there. And then there's that other hurdle of changing the habits and following through with whatever you're asking them to do. So these are the things that you can ask yourself if when it comes down to determining if they're really ready for therapy. Now, if you're in a private practice, obviously you have a little bit more flexibility with who you can serve. You can, I mean, if you're working in special education, obviously you don't have as much flexibility with turning people away and deciding which clients you want to treat. But these are some things that you can use to assess their level of readiness, because even if you are treating them and they're not quite ready to work on this could impact how aggressive you are, or maybe aggressive isn't the word, but assertive you are with certain techniques, because you might be able to go full throttle with people who are at full readiness, but you might be spending a lot more time with just educating and the buy-in for people who aren't quite at that level of readiness. So I wanted to circle back around to some of the things that I was talking about last week, or not last week, a couple weeks ago, is that whenever you're asking someone to change their habits, you want to consider that, and again, when changing a habit is hard work, so in order for there to be adequate motivation for you to change something, the pain of staying the same must be greater than the pain of changing. So if they don't see there's a problem, where's the motivation to actually follow through with what you're saying? So here is the process that we went through in order to really talk this particular case with the example that I gave, to really talk them through helping to understand why we were doing what they're doing. So the goal here, when you're really at that buy-in stage, is that I know that, you know, and I've reiterated this myself as well, that you are the expert and you bring a ton of knowledge to the table. But when it comes to getting buy-in and building that relationship, this is the time where you are controlling the conversation, but they're doing most of the talking. So you're going to be asking questions, and you're going to want to try to get them to explain the situation, because ideally what you want to happen is you want them to explain the difficulties that they're having and the gravity of the situation in their own words. And then when you're describing the impact of the issues that they're having, you're using their own language. And they've essentially just given you that information. They've explained it themselves rather than you just trying to kind of like spit information out at them. I know that I've made that mistake early on in my career when I was, I would go in there with my evaluation report and be reading off all these numbers and not really listening to the parents and not really paying attention to what they thought was an issue and what they didn't think was an issue. And it did cause some tense situations where I might have been able to help the parents see the issue by asking them questions and listening rather than just trying to go in there and educate them. Because there were a couple times, I know one particular situation, I kept saying, well, he's delayed here and he's delayed here and he's delayed here as I'm going through my report. And the psychologist said that every time I said the word delay, the parent just, like the mom just flinched. And there might have been some ways that I could have asked her questions about her child in the way that he interacted compared to some of the older children. This was a kid who had a bunch of older siblings, and he definitely needed services, but I could have explained that a little bit better and gotten her to describe the difficulties that he was having without her feeling so defensive. So the first thing that I have done in a lot of these cases, and again, sometimes you want to try to get them to describe the problem as much as possible. There might be times when you might have to jump in here and describe what you've seen, or maybe have the teacher describe what they've seen. It's ideal to have the person that you're wanting to get buy-in doing the explaining, but the challenge here is that a lot of times, especially with parents, they're so used to doing things for their child that they don't necessarily realize how bad it is and how much their child can't do certain things because they haven't given them the opportunity. So they might say, oh yeah, everything's fine, everything's great, but it's really just because they haven't necessarily put their child in that situation where they have to use those skills. And so this is kind of a delicate balance, but as much as possible, and a lot of times parents have gotten so used to dealing with whatever the situation is that they have convinced themselves that it's not as bad as it really is. And your job here is to get them to see how significant the problem is. And again, this is a very delicate balance. You want to make sure that you're listening, you're coming from a place of caring and concern here, and not from a place of judgment. But really the key here is that you're getting them to describe all the situations where their child is having difficulty communicating and how it's impacting their lives and their ability to do the things that they want to do. Because what usually happens is that when we're in a challenging situation, we get really used to dealing with it. And what a lot of people do in our lives is say, oh, it's okay, it's not so bad. Like, think of how many times, like I can think of times where I've been in conversations with friends where there might be some of their children who might need services, and then the other parents will be like, oh, he'll talk when he's ready, it's fine. And I'm like, no, it's not fine. That's not normal. And it's not from a place of trying to be mean. It's from a place of like, hey, there's an issue and it's affecting him, and you know it's affecting them. And it doesn't do them any good if you're kind of softening the problem and enabling them, or not enabling, but telling them that something's okay when it's not, because you know that it's not okay. So the goal is to try to pull that information out, get them to describe the problem, so that you simply, when you're describing how significant of an issue this is and why you need to fix it, they've given you the language to do that. So you're really just asking them to describe how their child interacts. So, you know, and again, there are a lot of validating statements that you can do here to make them feel heard without telling them that it's okay that their child is not where they are from a communication standpoint. So you can even say things like, you know, commending their effort, or just even acknowledging that they're working really hard to advocate for their child or whatever. Validating part of what they're saying without telling them, oh, it's not bad, he'll catch up, it'll be fine. So, you know, I know that a lot of times when we're having these conversations with parents, it's really easy to say things like that to kind of soften it, because we hate to see parents getting upset when we tell them the news that their child isn't where they need to be. So you want to validate what the right things and make sure that you're emphasizing the things that are an issue. So again, then the things that you don't want to be saying is, oh, it's not a big deal, everybody has that problem. Well, you know, those kinds of things. You don't want it to sound like this is a problem that everybody has, because then that might, when you do that and when you validate like that, then they might think, oh, well, he'll just grow out of it, or it'll just get better. And what that does is that it temporarily makes them feel good enough that they don't do anything about it to solve the issue. And what you want them to do is to acknowledge that there's an issue, that they follow through with what you want them to do at home, or what you want that particular client to do outside of therapy, if it's somebody who is cognitively and has the maturity to be able to follow through with those things. If you want them to follow through with those behaviors and those things that you want them to do outside of therapy. So, and if you make them feel like it's not that big of a deal, it's really less likely that you're going to get that compliance. So again, when you're doing these meetings, again, remember, when you're having these conversations, you want to be the one that's leading the meeting as far as just controlling the conversation, but at the same time, you want them to be doing more of the talking, because you're simply asking the questions about how much this issue is impacting their lives, and you're simply there listening to them. And then periodically you're going to be reframing and repeating it back to them. You're simply using their language. So you might start this out by saying, we're going to talk about what's working, what's not, and then come up with a plan together. So you might say something like, okay, we're going to talk about what's going on with Johnny's speech and what's going well, where he's struggling, and then we're going to try to figure out what to do about this. And so that way you're kind of framing a conversation, telling them about how it's going to go, because what you don't want is for them to start, you want them to be able to feel like they can ask you questions, but you also don't want it to be a complete free-for-all where they're dominating the conversation, because you want to make sure that you keep it focused on the main issues. So the next thing you do after you set that standard is you're going to be using open-ended questions to really just uncover what that problem is. So tell me about what's happening with Johnny's stuttering, and then really just see what they say and see what kind of information that they give you. And now how much you're going to get in this stage is dependent on what stage of awareness they are. So for example, with that particular student that I mentioned, where it was a fluency issue, the teacher and the principal thought it was an issue, but the student and the mother did not. They just said, oh, it's fine, and so at that point, I couldn't really do much there. I couldn't really continue on with the rest of this process. Obviously, I dug a little bit deeper, but they really weren't giving me anything that I could use as leverage to explain why we needed to continue. They weren't at that stage yet. Now, in another situation, I had a student who was not following through with her articulation exercises that I was giving her. And I said, okay, so tell me what's going on. Like, how is it going with speech? And, oh, it's fine. Oh, and she'd kind of just blow it off. But then when I would dig further, it's like, okay, so like what's, when you're raising your hand in class and you're wanting to share something, how's that going? Well, a lot of times my teacher asks me to repeat myself, and that's really annoying. And, sometimes people don't think I'm smart because I can't say my R's. And so I had to dig a little bit there. So this was a case where she wasn't following through, but when I actually dug a little bit, she was aware that there was a problem, so I could use that as some additional leverage. With parents, especially with those kids who, maybe they're using devices and you're wanting to get them to do some things at home, it's like, okay, tell me how things are going at home. Oh, it's fine. He's pretty independent, but then it's like, okay, so how well, like what happens when a neighbor comes over and they try to talk to your child, and then sometimes as you dig a little bit, you don't want it to sound like an interrogation, you want it to sound like a conversation, but sometimes as you kind of dig, they might be a little bit guarded, but you might be able to get some information out that's showing, oh, okay, yeah, like you guys understand what he wants, or you think that you're inferring what he wants, but other people can't understand him. He can't really ask for what he wants, and he's not really functional. And you're saying that you would like him to be able to have friends and be able to go to a restaurant and order food, and you're finding that he can really only function with you guys. And so you want to try to use that part when you're just describing their life and what's going on, to pull some of those things out. And again, the reason here is that you want them to see the reality of the situation. You're doing it in a compassionate way, but at the same time, you're not letting them just sit there and kind of be in denial. And you want to try to take a stand for them as much as you can and really dig in and help them see how this is impacting their life or their child's life. So after you go through and you kind of get an idea of what's going on, then you're going to do a little transition here and just kind of summarize what they've said. So for example, let's say that they've been going on and on about how this is affecting their child's ability to communicate. No one can understand him. Relatives come over. He can't talk to his grandparents. Whatever the issue is, and you just kind of, you're going through that first part for a couple of minutes. And then what you're going to do after you feel like you've gotten a pretty good idea about what's going on, you just summarize. So they've been mostly talking, and now you say, okay, let me make sure that I understand what's going on. You're saying, this, and then you basically just repeat back what they've said so that you're showing that you are listening. And what this does, hold on a second, I just heard my speaker go out. Let me make sure that it's fixed here. Okay. All right, I'm back. So basically what you're doing here is that you're showing that you're listening to them and making them feel validated by repeating back what they said in their language. And then also you are illuminating the situation. And the thing is that this is better than you just sitting there and reading your report, or, like giving them a handout and kind of going through it and lecturing, because they have given you that information. That's, you know how it's impacting their life because they're the ones that have given it to you. So essentially, you're trying to get them to convince themselves that they need to follow through with what you're doing. Next, so once you summarize that, you've talked about how bad things are. Now you're talking about what they want. So this is called future pacing. So you want to figure out what success looks like to them. So let's say, for example, I had a student who was, again, another fluency, very intelligent, and yeah, I like to use fluency as an example here, because some people who have never had a fluency issue will be like, well, their goal should be that they're fluent 99% of the time or whatever. But maybe that's not the goal. This student in particular, he was a very, he was into theater, and he was a really good singer. He would give presentations at church. He would read Bible passages, things like that. And he was pretty confident, but it frustrated him that he had a hard time with stuttering at times. Really what he wanted was to be able to control it when it was important to him. And then when he was home talking to his mom or whatever, like, he didn't care if he was stuttered. So really the goal wasn't for him to be fluent 100% of the time. It was for him to be able to use his strategies when it was important to him. And on the rest of the time, it wasn't that big of a deal. So you want to figure out what success looks like. For my student with the articulation issue, she's like, oh yeah, I want to be a reporter, or I want to be on TV, or, you know, be able to interview people. And it's like, well, if you can't say your R's, that might have an impact on your ability to do that, because people might not understand you. They might not, you know, you might not sound as articulate. And so the thing is that what you want to do is figure out where they want to go, and you want to figure out what they're doing right now and make them put that together. So for example, with my articulation student, it's like, okay, you want to be a TV reporter, but do you think that those people who are really good have probably been working on their public speaking skills for a long time? And do you think that if you're never working on your speech and you're never working on improving that, are you going to get over here with what you're doing right now? And what she was doing was not anything to work on her speech. And it's like, okay, no, if I need to get here, I need to be doing X, Y, and Z. So what you want to do is draw the connection between, if you continue these current habits and you want to get here, are you going to get here? What's going to happen if you don't get there? A lot of parents who, with a lot of our parents who, they're not reading with their kids, it's like, well, what do you want for your kids? Well, I want them to be smart. I want them to, have a good job, go to college, if those are things that their parents want. And it's like, okay, if you're not reading with them and he's not going to pass his basic reading competency, is it likely that he's going to get into a college? Well, no. Okay, so we need to change some of those things we're doing now so that we can get here. So this is guided by them. It's not what you think they should want, it's what they want. And so you're drawing that connection between what they want and what they need to do to get there. This is really key with a lot of those kids with multiple disabilities, because I know I had a student who, she used AAC, and her parents were just culturally, they had certain expectations for what they thought she could do. Some people might expect, if they're in a situation where it's likely that they're going to need care their entire life, you really have to be clear on what those caretaker goals are for that particular student, because you might have one thing in mind and the parent might have something that's completely different. You want to be able to help them, to counsel them through some things that are realistic for their particular student, but also you just want to be aware of what it is so that you can, again, future pace and show them that connection. Like, okay, you want her to be able to be in an assisted living and be able to, go down to the dining hall and ask for what she wants when she eats and have a conversation with her friends, but okay, right now you're saying that you're not spending any time at home trying to use this device. Do you think that that's going to get her there if we're not even working on anything right now? And again, you got to be careful with how you word these things, but that's just an example there of, you want to always be referencing what they want for their particular child. And again, after that particular stage, you're going to, again, get the information from them, and then you're going to summarize what they said and then reflect that back to them, again, to the point of showing that you are listening, but also really reiterating that point that they've already made themselves. And so you might say something like, did I get all of that? Did I miss anything? Asking those questions to make sure that you're understanding them correctly. And so then after that, Once you've gone through, then you can transition to some kind of an action plan if those other stages have gone well. And if they're at least at some stage where they're admitting that okay, I need to do something. So you're going to be transitioning to that action plan where you're coming up together now that you've agreed on there's an issue and we need to work on this in order to get to whatever our goal is for the long term. Then we transition to what we actually do about it. So you want to come talk about who's going to do what, how often, and when, and then you can assign specific things. And I always say with when you're recommending that people do things at home, I would err on the side of giving them one thing that's really simple as opposed to a whole huge checklist. And I know that in our mind, we're always like, oh, well, you got to do all the things and you got to do this, this, and this. But if you have a parent that's not doing anything, if you can just get them to do one habit at a time and then build on it, then that is better than doing nothing. So I would say that a consistent plan for this is better than a perfect plan. What you want here is consistency. You want that client to be doing something to help their communication outside of your session. Even if it's not the perfect plan, you want them to be doing something. You want to try to get them to get to some kind of a small win, because that's only going to help them with that buy-in. I mean, if you can, like, for my clients where I was working on speech sound disorders, a lot of times what I would do is I might just give them one word to work on, or one concept. Instead of giving them this massive word list, I give them one thing. I'd say, okay, we worked on closing syllables this week, and so I want you to work on the word pop, and you're going to play with bubbles, and you're going to, whatever activities they can come up with, and keep it really simple so that it's not, they don't feel like they have to do all of these different things. And if they've been doing nothing, maybe just focusing on it for 5 to 10 minutes a day, 3 to 5 times a week, that's a good place to start. So you want to clarify those things there. So that's what we did, essentially. We kind of went through this process with that particular student that I mentioned that had ASD, ADHD, sensory processing disorder, all different kinds of diagnoses, and we weren't really sure which one was the most appropriate. That's what we used. And what happened was that I know in first grade, we, she was ready to pull him out of school. By the time he went to 7th grade, we were really on the same page, and his mom really felt good about the relationship we had. And so she was following through with a lot of the things that we recommended. And we didn't always have to go through this entire process the entire time.
Hey there, it's Dr. Karen. I want to extend a huge thank you for checking out this coaching call segment. To show my appreciation, and because I know how much you'd like to be able to make a huge impact on even your trickiest cases, I'm going to make you a special offer to get you there even more quickly. If you've made it this far, I can already tell that you and I are a lot alike. I remember what it was like when I had certain students who just didn't respond to anything I tried. I tried digging through tons of materials and articles so I could show up to work confident, but no matter what I did, there were still always certain cases that had me second-guessing myself. And I'd go to seminar after seminar, which cost me a lot of money and took me away from direct therapy time, not to mention my personal life. But those conferences I was attending were all coming up short. I'd get back to work and get stuck immediately. I had no one to support me in implementing the techniques that I'd just learned. I had no way to ask questions and get support with the new strategies I'd heard about at the conferences. So I'd always just end up going back to the tired old techniques I was used to that just didn't work. It was beyond frustrating. All I wanted to do was help my students and make a difference in their lives, actually get some recognition and respect for my coworkers every once in a while, and still be able to have a life outside work. If you've ever felt the same, you're not alone. I've mentored hundreds of SLPs, and they've experienced this too. They wish they had a place to go to get questions answered, but they're afraid of even asking in free online groups because they've seen other people get shamed and bullied. Plus, they're sick of wasting so much time on social media. They're tired of going to conferences and hearing about techniques or programs that won't work for an SLP in the trenches. They just want some advice and support from someone who gets it so they can change their students' lives without sacrificing theirs. And since you've shown me you're the kind of person committed to your career and your learning by watching this coaching call, I wanted to offer you something that will dramatically help you increase your overall success and get your results even faster. It's called SLP Learning Academy. So SLP Learning Academy is an online coaching program designed to help pediatric SLPs make breakthroughs with their toughest cases and workplace challenges. So far, in the program, we've held coaching calls just like the one that you just watched. And I've talked about topics such as how to get teachers to buy into classroom accommodations and language facilitation techniques, how to support literacy growth in young children with parents who don't speak English, how to interview people in a way that motivates them to follow through on your recommendations, how to support secondary students with conditions like ADHD and ASD, including writing goals for these types of students, how to handle scheduling logistics so you can do more classroom-based therapy, and how to navigate the RTI process with ease, and how to do that as an SLP supporting school-age children. And I can support you through any type of case study that you might have as an SLP supporting school-age populations. So here's how the SLP Learning Academy works. Every week, I host a live coaching call on an online conferencing software. On the call, members can have a face-to-face conversation with me where we can work through whatever you're struggling with at work, or they can submit their questions in advance, and I will answer them on the call, like the call that you just witnessed. So here's why this model works so well and why the program is structured the way that it is. Number one, you'll get access to expert coaching, which has been proven to make lasting changes to our practices, unlike one-shot conferences that just dump a bunch of information at you and then leave you hanging. Number two, you'll get access to content-specific guidance that's tailored to the exact challenges that you're going through in your job right now. Number three, you'll get access to a professional learning community to keep you accountable so you'll have a place to go to get support whenever you need it. So here's what you get when you join. We do 4 live coaching sessions a month where you can hop on a call and get your questions answered and present any difficult cases that you're struggling with, or you can submit them in advance and I can go through them on the call and answer your questions. And then all coaching calls are recorded and uploaded to a members online portal. So you'll be able to rewatch them as many times as you want after the live calls happen. Then there's also the professional learning community where you'll be able to get support whenever you need it between the calls or whenever you have a question about a challenging case. So to be honest with you, I do offer one-on-one coaching packages starting at $2,000 for support like this, but I want to make this much more attainable for you. So that's why you can join SLP Learning Academy for just $39 a month, which will eventually go up, but you'll lock in this rate for life if you join today. That means you'll get access to personalized expert coaching and support for a fraction of your monthly cell phone bill. And since I know you may have been burned by other programs before that didn't deliver, I wanted to remove some of that risk for you, which is why you can cancel at any time. So now you have a choice. You can continue to work through all of this on your own, and you can be stuck on the same cases and be struggling with the same job-related stress a couple months or years from now, or you can have a place to go for legit answers from a trusted source every week. So you can wake up every Monday excited to go to work, have a solid plan for dealing with everything your SLP life throws at you, and so you can walk into each session 100% confident you're changing lives. All you need to do is click Enroll Now to become an SLP Learning Academy member today for just $39 a month. This is Dr. Karen, and I can't wait to support you. Click Enroll Now to become an SLP Learning Academy member today.